This is Mukund Kulkarni. I represented COVID-19 Chaitanya Vedhika. So today it's our pleasure to have the presence of Dr. Vijay Veldandi. He is a eminent infectious specialist and he served various organizations. There are several important areas of his specialization, particularly in infection caused due to transplantation, maybe liver transplantation or heart transplantation, whatever transplantation. His work in HIV, and he has also published several papers in viral as well as fungal infections. And we are also happy to share that he has received several awards for submitting various papers in various journals and also in health related work. So it's a pleasure. So welcome, doctor, to this. So we have something from you to know, because you are the right person to discuss, because you are an infectious specialist. So first of all is that our people commonly ask how I can help my family members who are with COVID-19 at home.
Things that everybody needs to understand is that COVID infection does not cause symptoms in everybody. There are some people who just remain completely asymptomatic, but unfortunately even asymptomatically infected people can spread the virus to other people. So the first thing that we need to think about is how to limit the spread of other people. From last year to this year, what we have seen is a marked increase in the number of people getting infected and becoming symptomatic, particularly in families. We see entire families come down with the infection. We see entire buildings have lots of people come down with the same infection. So what I would suggest is that first and foremost, we should always remember that this infection is primarily transmitted through the air that we breathe. Now, whether this is airborne transmission, droplet transmission, or anything else, in my opinion, is a sterile debate. The reality is, to prevent infection, one needs clean air, uncontaminated clean air. So the key is adequate ventilation. Open areas with lots of fresh air will reduce the amount of virus in the air that anybody breathes. Now, if we cannot affect that, then the next best thing to do is to put on a mask like I have here. A simple cloth mask is quite effective. Now, if you like, you can add yet another mask on top of this mask, and probably that makes it even more effective. The nice thing about cloth masks is I wash them every day. So I don't have to worry about a disposable mask that becomes ineffective after 6 to 8 hours and I have to throw it away, and that pollutes the environment. The next thing to remember is that many viruses, not just COVID, but many viruses are also spread through contaminated hands, particularly because we touch our nose, our mouth, our hands get contaminated, and if we touch other people with those contaminated hands, we are spreading the infection. So next to clean air, clean hands are very important. Now, we've come to know that you can contaminate the environment. However, we've now learned that the possibility or the probability of acquiring the infection from a contaminated surface is not as much as we feared about a year ago. So very rarely do we transmit an infection by touching a contaminated surface, and it is very easy to clean a contaminated surface. This virus, fortunately, is very fragile. Simple soap and water will get rid of it. So if you have a contaminated surface, just clean it with simple soap and water and allow it to dry. If you can expose it to sunlight, that's even better. So for anybody who is sitting at home, you're worried about what will happen, can I get the infection, can I spread the infection? Remember, clean air, clean hands, and a clean environment. The next thing to remember is, please do not get worried. It's important not to be afraid of this virus. What is important is to recognize that in some people, this virus can cause a lot of trouble and cause a lot of illness because it causes a severe inflammatory reaction in the body, and that particularly damages the lungs first, so it makes it very difficult to breathe. The best things in treatment are anti-inflammatory treatments. There is no antiviral that has ever shown reduction in mortality or reducing your risk of dying. So please remember that you don't need to go hunting for antiviral drugs to stock at home. If and when you do have symptoms, it is important to look for those symptoms. It is important to look for markers of inflammation in the blood. These are very simple blood tests like CRP, ferritin, and D-dimer. And if those blood tests show a lot of inflammation, there are anti-inflammatory medications that work very well. And in those people who are becoming symptomatic or who are infected, the best thing to monitor is the oxygen level with a simple pulse oximeter. Put a simple pulse oximeter on your finger, and as long as your oxygen saturation is over 94%, you're fine. If the oxygen saturation is dropping below 94%, it is time to start using dexamethasone. Dexamethasone is so far the only medication that has been shown to save lives by reducing mortality. No other medication, let me stress to you, no other medication has been shown to reduce mortality or save lives. High dose vitamin C, zinc, high dose vitamin D are completely without any benefit whatsoever, and it's quite possible under certain circumstances these high doses may hurt somebody. So please avoid taking high doses of vitamin C, high doses of vitamin D, and high doses of zinc. In the same vein, let me make it very clear that there is absolutely no evidence that medications like doxycycline, azithromycin, or ivermectin are of any use in COVID, either for treatment or for prevention of the disease.
When do we need to go to hospital?
So the only reason to go to a hospital is if you cannot have oxygen at home, number one. Now there may be other reasons to go to a hospital. For example, if somebody has other illnesses like diabetes or heart disease or lung disease that have become much worse for a variety of reasons, including COVID. For example, we do know that COVID makes people's diabetes much worse. We do know that people with pre-existing lung disease or heart disease become much more ill with COVID. They are unable to withstand that COVID infection and will require in-hospital care. So whenever somebody really requires in-hospital care, like a lot of oxygen or other critical care, that is the time to go to a hospital, not otherwise.
We are seeing in media now, there is a lot of news and noise about the usage of Remdesivir, whether its availability, its usage in the treatment. What is your opinion on that?
So I don't think we should care about my opinion. I think we should care about the evidence. And it is quite clear from all of the research that has been done to date throughout the world that Remdesivir has not proven to reduce death rate. At best, under certain circumstances, for some people, perhaps it will reduce the duration of illness. And even that is quite debatable. So I don't think we should ever depend on people's opinions. Only evidence matters.
Very often people are also asking, smokers and alcoholics, can they continue with the treatment with their usual lifestyle of smoking and usage of alcohol?
Well, let's think about what happens with COVID. In addition to everything else that COVID does, this is an infection that causes a profound suppression of the immune system. It's almost like having acute HIV/AIDS, right? And when you have a viral infection that causes such profound suppression of the immune system, you are at risk for getting into trouble with other infections, for example, tuberculosis. Now, we also know that both smoking and alcohol use also damage the immune system. So now you are compounding one problem with another problem. This is like mixing two poisons together, so this is what we call toxic synergy. So if you have an infection like COVID, what you want to do is you want to absolutely avoid anything else that will depress the immune system and compound the problem.
So, we would like to know how safe is the vaccine usage?
So, one thing we should all remember is every vaccine that has been produced to date, every single vaccine, the sole reason for that vaccine to be used is because it ensures that the vaccine will be less of a problem than the actual illness, right? So, what we are trying to do with any vaccine is prevent the infection or at least prevent illness. That is the rationale for any vaccine. Now, throughout the history of vaccination, we have always seen that with any vaccine, there is a very, very small number of people who have problems. But fortunately, what we have seen with every COVID vaccine to date, that even the people who have problems, the problems are very mild and they are transient, and most of them have recovered. So, if you look about and see what is happening, if anybody gets COVID, of all of the people who get COVID, 10% of them have symptomatic illness. Out of these people who have symptomatic illness, at least half of them are quite disabled, and a small number, maybe small, but for the person who dies, it's not a small number. Some people do die, right? And I will also tell you what we have now most recently discovered, that even people who have recovered from COVID, if you follow them for the next 6 to 9 months, a lot of them have a lot of clinically significant illnesses, and some of them actually die within the next 6 to 9 months of other complications. So, having COVID infection is no fun. Having a little bit of a reaction from COVID that makes you want to rest in bed for 2 or 3 days or take a little bit of paracetamol, no big deal. Out of the millions of people who have taken the vaccine, a very few numbers, less than 50, have had serious problems, medically serious problems. Now, when you look about and see how many people are dying of COVID now, at a population level, we think as epidemiologists that that is an acceptable risk. The benefit far outweighs any risk to anybody.
So, you mean to say that at least they have 50 to 60% protection compared to a person who is not vaccinated?
No. The efficacy of the vaccine is very high. What we have seen, for example, in one of the recent studies that I saw, out of 77 million people who got the vaccine, there were less than 6,000 people who got the infection. So, after vaccination, getting the infection is a very rare occurrence. And even after getting an infection after the vaccine, anybody developing a clinically significant illness or dying from it is extraordinarily rare.
But does this people who take vaccine, can they prevent transmission of the virus to others?
There is some limited data to suggest that at least some of the vaccines reduce transmissibility. Okay. I think we need a little bit more data before we can define the exact magnitude of the reduction of transmission. But it's interesting that the reason we did not make this claim before is that we did not have any evidence whatsoever of the reduction of transmissibility. But now we do have evidence that there is a reduction in transmission.
Can vaccination be taken in breastfeeding mothers or during pregnancy or during menstruation? What do you say about it?
There is absolutely no reason to avoid it during menstruation. Zero. There is no reason to avoid it while breastfeeding. Zero. Now, what happens is, whenever a vaccine is tested, we initially avoid testing a vaccine in pregnant women because we don't know what the potential harm could be to the baby, to the developing baby. So, it is standard practice during the development of any vaccine, or for that matter any medication, to avoid testing it in pregnant women until there is enough data to suggest that there is safety. Now, what has happened is that in the initial vaccine trials, a lot of people who did not realize that they were pregnant at that time went ahead and took the vaccine. And what we found is none of the pregnant women had any problems with the vaccine whatsoever. So, in some countries, for some vaccines, there is no bar against taking the vaccine during pregnancy. I think in India, this is a decision that should be made by an enlightened physician and an enlightened pregnant woman, because they together should make that decision, balancing the risks and the benefits.
This pricing differentiation in vaccine, today you must be seeing through media and all, that the rate which is sold for central government is different, state government is different, in private hospital is different. What do you feel in the given situation when the pandemic is so severe, how should we really go about to ensure universal vaccination?
So, we infectious disease people always like to say that all infections are equal opportunity offenders. They don't care whether you are rich, poor, powerful or not powerful. They infect everybody and they kill at an equal rate regardless of whether you are rich or poor. So, I tell everybody who is rich that if you want to avoid getting infected, the best way to use your wealth and power is to ensure that nobody gets infected, right? Now, if we want everybody to be safe, then we want everybody to be vaccinated. So, as a matter of public policy, I think that we should do everything in our power, whether we are in the private sector or the government or the public sector. We should collectively do everything in our power to ensure access to the vaccine to everybody equitably, regardless of wealth, caste, creed, religion, whatever. That's the only way that we will protect ourselves. I would extend this a little bit further. I would say that if we want to avoid getting into trouble with infections in particular, we need to ensure not only we as humans are prevented from getting infections, we need to take care of our animals and we need to take care of the environment. This is the concept of One Health. Because if we don't take care of the environment, the animals get into trouble. And when the animals get into trouble, we will eventually get into trouble. Let's take, for example, the recent outbreak of Nipah virus encephalitis in Kerala. What happened? You see, the habitat of the bats was encroached upon by humans. So, the bats and humans came into contact much more frequently than before. So, a virus that causes no trouble whatsoever in bats, Nipah virus, suddenly started infecting humans and causing trouble. But who did that? We humans did it. We were indiscriminately spoiling the environment, we affected the animals, and it came back to bite us. So, I think that COVID-19 is a warning from nature. We should not ignore this warning. To avoid something even worse than COVID-19, we have to care about the environment, the animals and humans. We are a continuum, One Health.
Thank you, Doctor. We are quite pleased to have you in this program, and you have definitely given us valuable inputs, valuable information. And I hope, lastly, what you said, we need to protect the environment also. That plays a very important role. So, thank you very much, Doctor.